What you want now?
Fala pessoal, tranquilo, aqui tá falando André Gamer, trazendo pra vocês mais um vídeo pro canal. E hoje eu tô aqui com o vídeo de Cirurgias. Não sei como se pronuncia, não sei, mas pelo menos é um vídeo diferente pro canal. E vamos lá, cirurgia do dente, alguma coisa assim.
Virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure today. A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems. Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32. Before we begin, let's get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First, insert a positioner into the patient's mouth.
A goela dela. Ai meu Deus, eu já fiz isso daqui. Gente, isso daqui dói. Isso daqui dói muito, tem que apertar e
Next,
fica
position the
embaixo da
X-ray
boca.
cylinder where
Olha a
indicated.
carinha dela. Olha que cara mais linda. Tipo, não tá doendo nada, tipo.
With the
tipo,
X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure. I couldn't have done it better myself. I'll have my assistant finish up the rest of the x-rays, and then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots, and now that all of the x-rays have been completed, we can extract our patient's wisdom tooth. The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have two or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic. To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain the needle may cause.
Cotonete nos dentes. Não.
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
São os dentes amarelos, hein, filho? Ai, a língua dela ficou de
And now we'll give our patient a few minutes to become completely numb.
5 minutos later, a musiquinha. 5 minutos depois.
Great. The patient's mouth is numb, and now we can move on to removing the wisdom tooth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
De anestesia. Ai! Ai!
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
Agora vai tirar o dente. Ai. Olha o barulhinho. Ai. Esse sangue que
Now
voa
clean the
aí.
area using a surgical suction. This will allow us to check the area.
Mano, olha o buracão que ficou, velho. Que isso? Ai! Que malvado, ele joga direto no buraco lá.
Everything looks great, but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot.
Colocar a gasa por cima. Doeu nada, né?
Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth. When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number.
Tá. Pessoal, eu acho que esse vídeo tá ficando um pouco curto, por isso que eu vou colocar uma outra cirurgia. Então, eu vou colocar aqui a cirurgia e já volto. Beleza, pessoal, voltei. Eu tô aqui com... beleza, pessoal, voltei. Tô aqui com uma outra cirurgia e vamos lá.
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Cala a boca. Passar shampoo. Vou jogar o jogo da velha. A bolinha que faz. X. Bolinha. X. Passar shampoo na testa. Continuar, vai. Eita. Agora esfregar o shampoo na cabeça. Pra fazer espuma. Pra lavar o cabelo. Porque os piolhos tá bravo aí, né, filhão? Os piolhos. Tá, continua.
So fresh and clean.
Ó, perfeito.
Thoroughly rinse the patient's hair and we're ready to get started.
Ah, que legal. Agora o nariz. Ai, parece um palhaço, tem medo de palhaço. Tá bom assim. Ah, saiu sozinho. Agora seca.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Tá, vamos lá. A coordenação motora é boa. Tá, ó, tá bom por enquanto, eu acho. Aqui. Tá escrito nas estrelas e na testa também. O término.
That looks good to me. Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Calma que nem. Aqui. O massacre da serra elétrica. Agora eu deixo ele careca aqui atrás.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Agora vamos desenhar de novo. Aqui. Se der, eu vou fazer
Great
até mais
job.
uma cirurgia.
Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Ó. Ai, injeção na nuca. Ai. Que isso, filho? Você aguenta, hein?
Great, he won't feel a thing. Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
Fala sério que eu vou ter que puxar essa faca pra cortar ele. Ai, ai, ai meu Deus, ai meu core. Ai meu core, ai meu core, ai Jesus. Mano, cê é louco, velho. Que isso? Vamos lá, agora vamos sair rasgando.
Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
Não é o que eu tô pensando, né? Ah, não. Ai. Ó as gorduras. Ó. Isso se chama taco. Ah, pessoal, é assim que se faz o Doritos. Ó o Doritos. Ai, que piada bosta. Ai, é o barulho.
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Mano, esse negócio vai pular pra fora. Eita. O cara ainda tem pele pra costurar. Loucão você, hein, fera? Cê é louco, véi. Não, primeiro faz o... Corta o cabelo do cara, coitado. Depois corta. Onde é que ele vai colocar esse cabelo? Que eu quero saber.
Great, let's get to some dissecting. The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others.
Filha da mãe,
Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
Ai. Olha o barulho cortando bacon. Parece bacon com pelos.
Nice job! This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable. Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
Tá, furou a testa dele, agora é pra fazer o quê? Eita. Ixi. Ai. Vagabunda, você furou a testa dele toda. Aí, de novo.
Perfect.
Ah,
With
filho.
all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Tá sangrando agora. Sua filha da mãe. Faz isso com o pobre coitado, não. Dá umas batidinhas. Agora passar no cabelo. Porque sangue faz bem.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
Ah, não acredito que vai ter que pegar tudo isso, colocar no lugar. Pegar, colocar. Pega, coloca. Que trabalho que vai dar. Ah, não, já colocou já. Agora falta no outro lado. Isso é da hora, hein, cara? Bem louco.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site.
Olha os 3 pelinhos que foram
After the
colocados primeiro.
procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area
Agora tá
may be
vermelho.
sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days
shampoo.
after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft,
Então, pessoal, eu vou ficando com o vídeo por aqui. Eu espero que vocês tenham gostado. Se vocês gostaram, deixa o gostei, like favorito, compartilhe com seus amigos nas redes sociais. E bora lá. Pessoal, eu queria pedir um favor pra vocês. Se vocês gostarem de cirurgias, se vocês quererem mais, deixem aí nos comentários. Tá bom? Então vou ficando com o vídeo por aqui e fui! Farou!